Good afternoon, ladies and gentlemen. This is Bariatric Friday. Today is December 1st. My name is Kemal Erkan, and I am here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
I'm doing great, Kemal. It's great to be back on Bariatric Friday. We've had a fairly long stretch where we didn't do a live broadcast. You were traveling at some point. I was traveling at another. We are back, and I'm very happy to be here. Just to reintroduce myself again, I'm Dr. Irgau. I am the president of CHRIAS, or Christian Institute of Advanced Surgery. And as a surgeon, my specialty is bariatric surgery, which is weight loss surgery. And I partner with Kemal on every Friday to come and spread education on the treatment of obesity and specifically on bariatric surgery. So I'm very happy to be back here again.
It's good to have you back, Dr. Irgau. And most of our people, they don't know that you're not live, so you kind of do your segment away. So we had at the same time the program running at 3 p.m. So, but it's too late for that now, right? So the issue we are covering from the morbid obesity standpoint, there are several different things. As you know, last week I did a live session in our Turkey office in Turkish, and we did spend quite a bit time on bariatric. And thank you for all the education you have provided for me on the clinical side, which helps me to speak on these issues with confidence. So, but what I still see is how the morbid obesity or the obesity is taking what the perception of it versus perspective, and how whether or not you have to choose between this illness versus the other illness. Well, you know, obesity is not that bad. Just let's take care of this first because there's a drug available. They said, well, don't use it for morbid obesity because we have patients with diabetes, you know, need those drugs. And yesterday, I won't mention the meeting's name, but we had a meeting and there were knowledgeable people, and there it was kind of interesting how little the understanding was there, understanding of what we do every day and why we actually have this program every week is because we think that everyone who wants to get bariatric surgery or who's dealing with morbid obesity, they already have their bariatric surgery and everything is cool. So, and what we always tell people in this session, in these episodes, is that only 1% of the people who are qualified for bariatric surgery is getting bariatric surgery. 1%. Yeah. So it's 10 million people. What's 1% of 10 million? 100,000. So 9,900,000 people are not getting it. They're not getting it not because they don't want to get it. There are so many different issues with it. But again, the issue of treatment of morbid obesity is the main problem that we see as you know, when people are not filtering what they have to say. I know just from the statements that they make, they still don't believe that this is a major issue. Now, it's a major issue, and then we have surgical options for the most efficient ways, but we also have non-surgical options for the morbid obesity treatments. But again, the main thing is, which I'm going to need Dr. Irgau's help here, is that we as the medical practice surgeons in bariatric, we make those decisions based on the conditions of the patient. Not just because someone just walks into our office and we say, well, you need to get this surgery. No, what's the best for that patient? How we make that those criteria and how we process it and how we make that decision. So because of that, there are different types of options. So today we are going to discuss gastric balloon, which is a non-surgical procedure, which we are the first in Delaware. Did it in 2016 that we started.
Yeah.
So this is another option. So our goal from our program standpoint, we want to make sure that we give as many options as possible. And if patients are taking I'm not going to say just patients, if people are taking actions towards morbid obesity, if the medical practices are understanding this better, doesn't matter which method they use, as long as they understand that this needs to be treated, right? So today we have a little bit more fun part of one of the treatment options is the gastric balloon. So Dr. Irgau, we're going to need your help on that.
Absolutely. So essentially, we're dealing with a chronic disease, okay? It's a chronic disease in terms of its course, but also like many other chronic disease, it has different levels of severity, right? If we look at a chronic disease like cancer, for instance, Kemal, there is stage 1, there is stage 2, there is stage 3, stage 4, right? And that very often determines the type of treatment that the doctors will offer when they are faced with the different types, right? So it doesn't mean that the treatments compete with each other or they are mutually exclusive. These treatments are offered in concomitance, right? At different levels with different degree of involvement. So there may be a level 1 or a stage 1 cancer that may not require surgery, but there may be a stage 3 or 4 cancer where surgery is absolutely necessary, right? So as you correctly said, we want to get to a level where we look at obesity in the same way, not telling the patients even, okay, which one would you like, but telling the patient, this is the best treatment you have, right? That level of understanding of obesity is, of course, not yet here, but we are getting there. We're getting there with education, right? So today we're going to talk about a type of treatment that is different from the usual ones that we use usually. So it is the placement of a gastric balloon inside the stomach to treat obesity. Clearly, this is a very non-invasive procedure when you compare it with the actual surgical procedures where the doctor actually makes incisions in the skin and enters the abdomen. With the gastric balloon, there is no such thing. We do not cut the skin. The balloon is placed inside the stomach by entering through the natural openings, right? The mouth. We go through the mouth when the patient is obviously taking a nap and is sedated and is under anesthesia. So we go through the mouth with an endoscope. We reach the stomach and we have instruments that allow us to deliver this balloon inside the stomach and inflate it. Make it like a balloon, becomes a fairly good sized balloon that is relatively heavy as well, and we deposit it in the stomach. And the presence of the balloon mimics very much a stomach full of food, right? So that person will have the sensation as if they've had a really heavy Thanksgiving dinner or even 2 Thanksgiving dinners, right? So in that situation, the last thing that the person would want to have is more food. And really, we are curtailing the food intake, appetite, and hunger with the presence of the balloon, right? So the balloon can be placed in the stomach very, very safely, and it can stay in the stomach for 6 months. So one of the great appealing aspects of the balloon, Kemal, is that it is non-invasive, of course, but it's also completely reversible because at the end of the 6 months, we are removing the balloon. Now, one could say that this favorable aspect of the balloon, this advantage of the balloon of being reversible, is also a weakness of the balloon, right? Because we're not dealing with a disease that is transient. We're dealing with a chronic disease. However, we're utilizing a transient procedure to treat it, right? But in the right set of people, this actually could work well. And when I say in the right set of people, I'm talking about people who have a certain range of obesity. And we talk about typically class 1 and class 2 obesity. So these are people who have a body mass index anywhere between 30 kilograms per meter square and 40 kilograms per meter square. And it's important to compare that to the indications for invasive bariatric surgery like the gastric sleeve or gastric bypass, where the indications for the procedure actually are triggered at a body mass index of 40 or greater. Now, you can see the analogy with cancer, right? A cancer that is advanced, like a body mass index of 50, would not be considered as simple obesity, Kamal. That's a very severe obesity, right? So that needs to be treated much more aggressively with a procedure like gastric sleeve or gastric bypass, right? But when the obesity is not as significant as that, when it's between 30 and 40, we can utilize the balloon. As I said, the appeal of the balloon is that it is totally non-invasive. It is done with the person under sedation, okay? And then because it's non-invasive, because we're not doing any cutting, the potential for risks is also much less compared to the risks of other surgical procedures where we are actually dividing the digestive organ. Now, people will think, well, that sounds great. So how about the results? Well, the results are good for the purposes that we're looking, right? So when we're treating somebody with a body mass index of 32, clearly we're not looking for that person to lose 100 pounds. Far from that. We're looking for a person to lose, what, 20 pounds, 25 pounds, right? And that is the range of weight loss that you see with the balloon as well, anywhere between 15, 20 pounds up to 45, and sometimes even 50 pounds. That's the range. So the expectation has to be set properly, right? It is important to understand that if I get a gentleman with a body mass index of 55 and their weight is 380 pounds and they're expecting to get a lot of weight loss with the balloon, that's not going to work. In fact, that's not a good indication for a balloon, right? But for somebody who has a BMI of 32, 33, even 36, 37, and they really want to try something a little bit more than the medications, the balloon would be a good option. Now, one would say, well, if it's only going to be there for 6 months and then you remove it after 6 months, it means hunger can come back after the 6 months. Yes, of course it can. But one of the good points that the balloon, Kamal, is that if a person has the balloon for 6 months, maybe that will create a mindset for a person to also change the way they are approaching food, fullness, appetite, and eating habits, essentially. And in fact, our program, as you know, Kamal, requires for a person that is getting the balloon to have a nutrition encounter once a month, not only for the 6 months in which the balloon is in place, but for the full 12 months, which means 6 months even after the balloon. So what we're trying to do is we're trying to get the person to develop good habits whilst the balloon is in place, while the tool is there, and then try to maintain those habits in the long term after the presence of the balloon as well.
So I think one thing that you said is creating the mindset, but I'm going to probably use a different term. People who are dealing with morbid obesity or high-level obesity, the jump starts where you want to get some immediate results. So you want to be so at least see that you are able to lose weight. You know, many of these individuals are struggling with, I can't do it. You know, I don't see how I'm going to do it. So because of that, that's the mindset that we're choose to use. So then, like what I see, even with us, like you know, if we start a diet, when we start with the intermittent fasting, we want to see results, because if I don't see the results, it's not going to motivate me to stay in it for a longer time. So it's interesting enough, in our office now, at least 4 or 5 different individuals, after watching our sessions, they are doing intermittent fasting. My older sister, my brother-in-law, they are doing that in Turkey.
Right.
So that because they see results, right? So the balloon, I think what I see is, okay, so I don't have to do surgery, medication, the results are not as quick, and you know, I may not qualify, and it's also very expensive. So the balloon, although it's a self-pay procedure, there are some employer plans who are covering for it, which we are helping our patients with the process. There's some financing options available, but to see the immediate results, and then hopefully that becomes the new norm for them, it's a great jumpstart to to have that type of a tool. Now, in terms of risk, Dr. I know one of the things that we have in old days, I say old days, let's say 2016, 17, the dehydration was a problem. Is that still something that you see as a problem after the procedure?
Certainly, it is something we pay a lot of attention to. We don't see it as much, but it is something that we are very, very attuned to, Kemal. And what you're referring to is the early days after the balloon, when people may experience more nausea, feeling that really I don't want to take anything at all. And that includes fluids as well. And if they don't take enough fluids, obviously they are going to be dehydrated. In my view, this problem is much more prominent in the first couple of days, at the most the first week after placement of the balloon. And what happens essentially is, by placing this heavy balloon inside the stomach, we are creating a fairly sudden and great distension of the stomach. And that creates really a sensation of sickness almost, right? Where there is almost a slowing down of a lot of processes in the digestive tract, so the person really doesn't feel like having anything. We expect that to happen, and we actually take preemptive measures to try to mitigate that. For instance, all of our patients will have a very strong anti-nausea medication before the balloon is placed. Our surgery center, we're very fortunate to have access to these strong anti-nausea medications that are very difficult to find in a hospital setting, actually, Kemal, unless you're doing chemotherapy or other things. But these medications allow us to really make sure we are able to minimize nausea to the extent that I actually don't see it as much as I used to in the past right now. So those medications are there, but also afterwards, we will be prescribing different types of anti-nausea medications that will help the patients navigate the first couple of days. So preparing also the patients with that mindset is important. So when I do consultation for the gastric balloon, I spend a fair amount of time explaining that this could happen, and for patients to be psychologically prepared for that, right? Because you don't know until you've had the balloon what it feels like to have the balloon, right? It's a heavy, heavy object inside your stomach, and it does create that sensation of fullness, which is fairly sudden.
Like, is there fully, is it just like the feeling of it? Is it like when you have too much food, is that the same feeling that you are?
Yes, absolutely, absolutely. So I mean, the kind of thing college students will experience when they continue to eat despite having discomfort, right? So at the end, they will really regret they've had that extra dish, of whatever, or perhaps Thanksgiving. People may have experienced that in the recent holiday, where you just continue to eat despite the fact that you are uncomfortable. In which case, you will be uncomfortable for a while until the stomach empties, essentially. But the difference is the balloon stays there; it doesn't empty. But you do get used to it. You do get used to it.
It's relate to it, so that if that's what you're describing, eating too much, and then now you're suffering, which this Thanksgiving I wasn't here, so then I didn't have that problem. And then I was able to avoid my mom for 2 weeks with having signs in the house, so no begging for food or no insisting for food consumption. So and I'm not kidding, by the way, I did have like 2 signs in the dining room and in the kitchen. So is that is it something that they can get used to, or is it getting better like each day when they have that,
Oh no, the people get used to it very, very quickly, and also get used to it, meaning not to the discomfort itself, but they accept the fact that there is this heavy balloon inside their stomach, and the body adapts to it fairly, fairly rapidly. So within a couple of days, most people will be absolutely fine, and after that, they will be able to resume intake without any problem. So if there is concern about dehydration, it's really in the first 24 to 48 hours. After that, actually, it's absolutely fine. So we can talk a little bit about potential complications of this procedure. Obviously, the reason a lot of people choose this procedure is because they are concerned about complications with the bigger procedures sometimes. And I do see people even who would be good candidates for the gastric sleeve really go into the balloon thinking that they're exposing themselves to too much risk with the gastric sleeve. Having said that, as we were explaining to the board yesterday when we were talking about the secondary surgery center, the level of safety of procedures like the gastric sleeve or gastric bypass in programs like ours is so elevated right now that we consider them to the same risk level of things like gallbladder surgery.
It's minimally invasive, so it's like the same thing.
Absolutely. But yeah, but there is still the perception, obviously, and people obviously shy away from that until they are very educated. But I do think that they choose the balloon to some extent because their risk tolerance, at least their perception of risk, is mitigated by the choice of the balloon. Now, it doesn't mean there are no risks with the balloon as well. There are. Any procedure that we do has risks. So, but the risks are comparatively less, impactful when you look at the balloon. So, can somebody develop irritation of the stomach with the presence of the balloon? Yes. Can somebody develop heartburn? Yes. What do we do about that? Well, as I said, we focus on preventative measures, which means that, for instance, anybody who has a balloon in place will be taking anti-acid medications every day for the time in which the balloon will be in place for the whole 6 months. In fact, I do start anti-acid medications on these patients about 2 weeks before placement of the balloon, and I ask them to continue after that. Now, could you develop something even more significant than irritation of the stomach, even an ulcer? It is possible, but it's not very common. The development of the balloon over the years has been such that the surface of the balloon is relatively friendly to the surface of the stomach, particularly if it's kept within that 6 months period of time. Now, one potentially serious complication, Kemal, would be migration of the balloon into the rest of the intestine. Now, if the balloon stays the way it is in terms of its integrity with fullness, there's no way it can escape into the rest of the intestine because the opening from the stomach to the rest of the intestine is too narrow. But you can imagine a situation in which the balloon becomes deflated, loses its fluid and becomes much, much smaller, in which case it could potentially migrate. And if it migrates into the intestine, it could potentially cause bowel blockage that potentially may require surgery to fix it. Now, this event is very, very rare. We certainly haven't seen it ourselves, but it is something we obviously have to tell patients about, potential telltale sign that may have happened. One good thing, Kemal, is in our center, actually, we fill the balloon with a fluid that has a color in itself inside. And if the balloon starts leaking, actually the patients will be passing urine that has green color or blue color. So one of the things we tell patients is that if you do find that the color of your urine has changed into green or blue, you have to tell us, because that could be a sign that the balloon is becoming deflated, so that we can intervene promptly and remove the balloon before it has migrated downwards. So as I said, leakage is very, very rare, but even if it happens, we have placed some measures that allow us to detect this early enough and then remove the balloon. Another way for the patients to really be alerted is that if they suddenly lose a sensation of fullness, right? The balloon is in place, it's full. If suddenly they don't feel as full as they were, they have to tell us, because that could be another indication that the balloon might have gotten deflated, really.
So I think just to recap, what I'm hearing is that the patient selection process is important for balloons. So not everyone is a candidate. So if your BMI is more than 35, most likely balloon wouldn't be the first choice. But let's say even if it's between 35 and 39, and then because you don't have comorbidities, then you do want to actually take advantage of this, then maybe a solution for that time. Those who are between 30 and 35, that would be the first choice in many cases for those patients, especially if your kids are getting married in 6 months. Probably this is the least complicated one with no bad outcome. And I know a couple of our, I think two of our physicians had this surgery, this procedure. One of them was public with it and one of them is not. But they did actually, the physicians went through this. And that's when I felt more comfortable back in 2017. So, and they kept it off. Now, in terms of the coverage, some employer plans may be covering, and if it's self-pay, there's financing available. You're able to finance it, and we will help you. Our office will be helping you with that. But I think again, for me, and also someone who has is up and down with the weight management, so we just need that courage to actually make certain decisions, and sometimes like complications, and sometimes the terms that we use, like surgery versus procedure. At this point today, I guess Dr. Irgau, you would agree with this. For you and I, if one of our family members is getting a gastric sleeve at the American Surgery Center, we know that they're going to be home by 8:30, 9 p.m.
Yep.
So that's already telling enough in terms of what this procedure is. 99% of the patients go home, at least in the last 2 years. So when I have that in my hand, this gastric balloon is almost like it's a popcorn. So it's like even more, simpler. So if you need that jump start, I think it's a good option. So what one of my what makes me happy these days, looking at the bariatric support group in our Facebook. So here's a patient just posted yesterday or the day before, 26 pounds, still under the wonderland. So they are their goal. They almost at their goal. Another patient is asking Dr. Peters for before 227, now 159. And I'm just giving you the latest one, so then I keep it in an album here. Now, here's an interesting one. The patient says, I need some encouragement. I'm down 69 pounds, 70 pounds. So she needs some encouragement because in the last 3 weeks, she didn't lose any weight and she's panicking. But then she's asking support group. And then the good thing is support group, the other people who have the same problem, they are going back and forth with her in messages. But if you just hear me, if you listen to me correctly, she's complaining about not losing weight in the last 3 weeks after losing 70 pounds. So that's pretty powerful, right? So
absolutely. There are periods that we call plateaus, in terms of weight loss, Kemal. So what we see essentially is that a person may be losing weight constantly for several weeks, and then suddenly there would be a standstill, right? But then it resumes again. So when they are used to seeing the weight come off really on a regular basis, then obviously patients become apprehensive if nothing happens for a good number of weeks. But that is actually fairly normal. That is pretty much something that is seen very often. And I do see that question coming up very often when I see patients at 6 months, at 9 months.
Isn't it like refreshing to have that kind of complaint after I lost 70 pounds? I'm like, I paused a little bit, and that's the problem you have now.
That's right.
And then the last patient is started at 2:30, January was the surgery, 9 months after, down to 160.
Yeah.
Now, these are all people who are in that group volunteer. Voluntarily, they actually share these numbers, and knowing how big of a struggle this is, our job from CHRIAS and from American Surgery Center standpoint, we want to make sure that all the options, all the tools are available for our patients. And the gastric balloon is one that we didn't cover for a while, although we were doing the procedure. Then we're like, okay, so there are people who are willing to pay $2,500 a month for medication that's going to give them only 15% weight loss. $2,500 a month for maybe 15% weight loss, which it's still better than nothing. Nothing, right? So then we have to make sure that these options are all available. So, and the best and the safest place is American Surgery Center. So, if anyone who may need these procedures, you can contact us through our website on CHRIAS. You don't even have to call the office anymore. You can actually, as soon as you get to the website, our AI system will schedule your appointment without talking to anyone. So we would be just happy to be part of your weight loss journey and be there when you are much healthier. And that's what we have for today. So, Dr. Ergau, thank you so much for joining us.
Thank you, Kemal. Appreciate it.
Two more live sessions this month. Next week, we are going to cover the smoking and alcohol, I believe, and after that, maintaining weight during holiday season. Although Thanksgiving is already gone, but we will see how we can help someone for the Christmas and the New Year time. So until then, we'll see you next week and stay safe. Have a great weekend. Bye-bye.
Thank you. Have a nice weekend.